does the UK need a lockdown 2.0?
We don't need a full lockdown. What we need is some very robust, clear messages, clear protocols, and decisive action and enforcement to prevent the virus spreading. Now, remember, after the first lockdown, we got down the daily new cases to around under 500. Now it's above 4,000. So we know that it is possible for people to behave in a way to prevent spread. We need to get back to that, and there are some simple but enforceable decisions that the government needs to make sure happen in the coming days.
Dr. Nagpaul, I'm wondering where the new cases are coming from. There is a huge debate about whether or not we should be sending children back to school, whether people should be going back to their offices, and whether or not they should be socialising in the evening. Where are we seeing most of the cases coming from?
So in the UK, and this is in fact replicated in Europe as well, the new cases have originally come from younger people, which is why initially we saw an escalation in cases, but not an increase in hospitalization to any marked degree. But what is worrying is that now those cases amongst the younger population are spreading to people who are who have underlying conditions, to older people, and we are now seeing significant, definite increases in patients being admitted to hospital on a daily basis, and also seeing significantly increased numbers who are now on ventilators. Now, that's not the same as the levels we saw during the first peak, but as you heard today, the warning is that if we don't act now, we could start to see a real magnified level of spread and hospitalization. So what we must do, and what the important point is, how do you the question is, how do you reopen society in a safe way? How do you allow people to go to work in a safe way? And what restrictions should be in place at the moment to prevent spread? What the priority really must be to bring down the infection and the spread of infection. And that is what will help the economy to reopen. By having a situation where we have these current, we have several local lockdowns in the UK, what that does is it paralyzes those cities. There are several, cities in the UK which are currently under severe restrictions, basically a local lockdown. And that's because the infection has been allowed to resurface in those areas to a marked degree. What we need is some very stringent measures, and that's not the same as a lockdown. So I don't think we need a national lockdown, but we need real enforcement of measures.